Okay, hey you guys. We are getting kind of down and dirty. We're going to talk about PMS and periods and ocular melanoma and all the good stuff. I'm Danet and I'm joined today with Kristen and Vikki, who are also ocular melanoma patients. And we are obviously from the younger crowd, which I know that doesn't make up the majority of us, but let's just kind of go around. What's one women specific issue that you have dealt with or struggled with more since your diagnosis? Kristen, do you want to go first?
Sure. Hi, everyone. I'm Kristen. I live in Chicago. I was diagnosed in 2021, so in my mid 20s. I would say that a couple things, just shortly, what I went through would be fertility questions, differences with birth control, periods, beauty standards, as like my appearance and body physically changed with treatment, and yeah, just overall lifestyle changes in my mid 20s that came about with my diagnosis.
Yeah, no, and obviously, like, none of us ever asked to be in this club, let alone to have to deal with being like a young hormonal, like, your body is doing all kinds of normal things that it should be doing when you're in your 20s or 30s. And then you're also dealing with treatment and side effects and anything else. And I love that you summarized so many of these different issues, Kristen. So we're going to come back to a lot of those. Vikki, what about you? What's like short answer, like one thing that you feel like you've had to deal with during your diagnosis?
Yeah. So, hi everybody. I'm Vicky. I am from Colorado and I was diagnosed with ocular melanoma in 2019 when I was 24. And I think for me, yeah, the biggest thing that stood out was, am I going to be able to have kids one day? Had been with my husband for, we'd been together since we were teenagers. So, we were obviously talking about marriage and having kids. So that was like one of the forefronts that I had thought about on my
Yeah.
original diagnosis. Yeah.
Oh my goodness. Yeah, so many things. So I'm also going to be participating in this discussion because I am also a patient. I was diagnosed in 2020 and I'm now currently metastatic. I live in Arizona and I have three kids. I was actually done having kids, or we could, argue that cancer decided I was done having kids for me, which was not really fun to deal with. But I will just say that, one of the things that I feel like I have had to deal with is that I have really severe PMDD. And that it just makes navigating all of the emotional turmoil that cancer brings into your life that much harder, especially 1 week of the month. So that's kind of what we're gonna talk about today, you guys. Like, any of you guys listening, please share this video, subscribe, like, and comment below if you want to tell us a little more about the things that you deal with, or just anything else that you guys want to have a discussion about. We would love to hear from you, and we're so glad to have Kristen and Vikki. And obviously, we know that we are three voices in many. So if we don't cover something or we say something that is somehow invalidating to you, like, please know that we're just sharing our personal experiences, and this is in no way meant to be medical advice. This is just us getting real about being women, young women, dealing with OM. So let's just talk a little about your eye treatment. How did this, interrupt or not interrupt your day-to-day life? Like, you guys were significantly younger than me. I mean, I was 28 when I was diagnosed, so I guess we were all in our 20s. But like, with your eye treatment, did you have, some major interruptions to normal life, or even like your cycle, and obviously like plans for the future? Let's just kind of talk a little about that. And let's see, I'm going to start with the youngest. Like, Kristen, I'm going to have you go first.
Okay, sure. Yeah, I think I was 26 when I was diagnosed. I mean, it was January of 2021. And everything for me came about pretty quickly. I had gone a year of going to doctors and trying to figure out why my eye pressure was so high. And so by the time I had an answer in 2021, they let me know pretty quickly that I would need my eye removed and that I would go next into radiation to treat the orbit, because there was concerns that with my treatment beforehand that cells had gone into the orbit. So I was kind of lined up pretty quickly to, get diagnosed, jump into eye removal, jump into radiation, and then what's next? Maybe an adjuvant trial, egg freezing. Everything really happened in like half a year pretty quickly.
Yeah.
And at the time, I was dating my now husband, Kyle. We had been dating for 3 years, but this was a very big interruption for us. And so in our relationship, he, just was quickly by my side supporting me. We went through, the travel to Philadelphia for the eye removal. And, he was so great to be the voice I needed to hear, that to let me know that I was still beautiful, even when I felt so grotesque. Removing an eye is very like
That's a
emotional.
lot. Yeah.
But I needed to, hear some of that validation at the time to know that even though I felt so physically changed, that he was by my side. And yeah, so that's just the start of it. It was definitely a long journey, and the egg freezing comes next, but we can circle back to that too.
Yeah, let's circle back to that. Vikki, what about you? Like, just your initial diagnosis. Tell us a little more about what was happening with you, because I know you said that you were also dating and that you had not gotten married or had kids yet.
Yep.
You had your treatment. Like, what happened then?
Yeah, so I ended up getting the brachytherapy. So I had the plaque radiation done to my eye. And, you know, I had asked questions initially, like, how does this impact me? My ocular oncologist pretty regularly was like, just keep living your life as normal. And so, as we also get our alternative oncologist that we go to for all of our like scans and follow-ups. So my other oncologist decided at that point that he wanted me to enroll in the Sutent trial. So I was on Sutent. So I did ask, like, what happens now, right? It's a form of chemo for those who don't know. It's a pill form that I was on for a year. And one of the questions I did ask was, does this affect my fertility, right? As a young woman, obviously, like I wasn't married yet, but we knew we were going to be together. So we were like, let's have these conversations. Not a lot of research done. And I think honestly, I was so overwhelmed by it all that I just didn't ask any more questions. I didn't do any egg freezing. I just jumped right in. A few years later, when we did start trying, it took us a while. Cause some, we don't know if that's from the chemo or just other life, but it was one of those things that we had talked about a lot. And it did impact my cycle. I think going through the radiation treatment, honestly, it's probably just like the level of stress. And then the birth control I was on caused a benign tumor on my liver, just all the things. So, of course, as we all know, the tumors on the liver, red flag. So that caused scares and all types of stuff. So I just think it impacts you as a woman in like just many different ways that it's kind of hard to think about. These are things that are like really just, you dream up and you dream of growing up and having a family, and we maybe have to experience that with another level of loss and grief,
Yeah.
or being scared of other things that maybe other patients that have ocular melanoma don't experience. So,
Yeah, no, that's such a good point. That level of grieving the expectations, grieving, what you thought life was going to look like, right?
yeah.
Up until this point, we all kind of have this internal picture of like, oh yeah, like, well, I'm going to do this, and then I'm going to do that. And like, obviously we know it's logically not set in stone, but it's just
Mhm.
having this interrupt so much of our life. And obviously, like you said, there's some physical things that are interrupted, right? You talked about cycle interruption and the fertility struggles. Kristen, like you talked about just changes in appearance, like rapid changes in appearance. Because when you have your eye enucleated, or even when you have brachytherapy, like there are some significant changes to your appearance when your eye is affected. I remember going through both of those things. And I think just maybe the one thing that I'll highlight that's unique to me is that at the time that I was diagnosed, I was 28 and I had a nursing baby. And so my baby was 9 months old at the time, my youngest Mel, and she is super sweet and super adorable, but I didn't really get to choose to stop breastfeeding. They told me that I could either stop breastfeeding, period, like pump and dump, basically, that I could pump during my brachytherapy week, or that I could just stop breastfeeding altogether, and that they would recommend stopping breastfeeding altogether just on the off chance of any, residual radiation and any of the risk to my baby. On top of that, being in treatment for brachytherapy, I wasn't allowed to be around any of my kids, right? Because I'm radioactive for a week. And so I couldn't be around them at all. Like I could talk to them on a video, and like it was exceptionally isolating, right? To be so young, to be going through something so unexpected, and it all comes together really fast. Like I know Kristen, like we've actually I think shared a little about your story on the podcast before, and I know yours was a really long drawn out process, but for the majority of us it's a pretty fast, like you get an appointment and then suddenly they're like, oh, you've got a tumor in your eye, we got to treat that, and within a month or two you're having treatment, like for the most part, maybe not everyone. And so it just goes so fast. And once it's all going, the ball is kind of just rolling. And then you get, biopsy results if you have a biopsy. Then you have the fallout of dealing with that, right? And then that leads into potential trials that you might participate in, which I also did, right? Like I did the brachytherapy, and then I found out I had a class 2 tumor. And so then like all of the grieving pieces of like grieving my vision, grieving life as I knew it, life without cancer, all of that like kind of culminated to then doing a clinical trial and dealing with, the potential side effects of that, which again, like I did the same trial that Kristen was. We were on the VPA and Sutent combination trial. I think roughly about the same time. Like I think you started maybe a year after I did because I was diagnosed earlier than you.
And
But
Vikki, you just did soon.
and you just did
Yes.
Sutent, right?
Yeah. Just the student.
And so like we had some of the same issues, right? Like Kristen and I, and well, all three of us, we had the Sutent, which, well, if you didn't know, it's a chemo, and chemo can affect fertility. Like they don't really know for sure how much, and they can't guarantee you anything. And so again, like I was at that point feeling like, okay, like I've got a class 2 diagnosis and I'm also taking this drug. Like I don't want to risk having more kids in this kind of a situation, like in this much uncertainty. I don't want to go through this again with another baby. Like that didn't feel like something that I could handle. But I already had 3 kids. Like I was not in the same situation as you guys where you hadn't even had the chance to solidify your life to have kids, like, or even contemplate that. Like it kind of like speeds up the timeline is kind of what I'm hearing, is like it speeds up the timeline a little bit of like, you have to talk about these things or they may not ever get talked about.
Castle Biosciences is a proud sponsor of this I Believe podcast. Castle's innovative uveal melanoma tests provide valuable information about the risk of your eye cancer spreading to help you and your healthcare team individualize the management of your disease. To learn more, visit castlebiosciences.com.
Yeah, and I'll piggyback off that. So what I found really interesting with that, with the trial, the student VPA trial and, fertility questions, I had asked those questions of like, what does this mean for fertility? Like, I'm not at that point in my relationship, but I could be down the line, and or I could just be on this drug for years until I'm in my 30s. And then that makes obviously fertility even harder at that point. And so the funny thing to, think about is they were letting me know that going through an egg freezing process is great, but even embryos are better. And I was like, how am I supposed to have that conversation with my at the time
Right.
boyfriend to be like, do you want to do embryos? No, I were just dating. And like while we were like serious at the time, it just felt like just funny. I feel like you're in these situations a lot where you're having to force the conversation for like years down the road that you wouldn't have thought about at that time. And I was more comfortable at that point just doing egg freezing rather than embryos. But I did talk to Kyle about it at the time, and like we laughed about it. He's like, if that's what you want to do, and I'm like, no, it's fine. This is really just like insurance for us anyway. And, God willing, like if we need to make embryos in the future, we will. So it's just like funny that those conversations of like trying to even think further out come your way, because even last year I was meeting with my fertility doctor again, and she was like, it's great that you're at this point in your Mets treatment that you're stable, but now that you're getting married and probably thinking about wedding planning and thinking about like family planning and things like that, maybe you should consider what that would look like. Would it look like surrogacy? Would it look like adoption? I'm like, I'm not ready to go there yet, and I think there's a lot of times where these conversations are brought to our attention before we're ready for it, because a lot of times when you're at this, for any patient, when you're diagnosed with ocular melanoma, you're thinking in your 2-month windows of like 3-month windows of between scans. And it's very hard to be presented a 3-year plan and try to like have that vision forward.
Yeah, no, that's a really good point. And I know like for Kristen and I, that's a little bit more challenging than I think. I mean, not to say that it's not challenging for Vikki also, but because Kristen and I already have a metastatic diagnosis to deal with, like it's that much more real of like living in those 3-month increments, or just kind of like there's this desire to plan for the future without really being able to concretely plan for the future. And that's definitely, it's a lot.
Yeah, I also would validate, what Vikki probably felt too, is that like even when I was in my no evidence of disease phases, I was like, what can I like responsibly plan for, and it was like, can I responsibly plan to get married? Can I, all of these things that when I was dating Kyle at the time, I was like, his path is intertwined with mine. And, if we continue to move forward, there's just question marks everywhere. And so I think that for any stage of diagnosis, it's definitely really, really tough.
Yeah. Okay, so Vikki, you went through the treatment and then you, I think you got married, and
Yes.
now you have a little boy who, if I'm not mistaken, is he 1 or is he 2?
He's 2. He'll be 3 in
Okay.
August.
Oh my goodness. So talk to us a little about like you mentioned that you didn't end up doing any kind of like fertility, like advanced fertility supports, like
Mhm.
egg freezing or embryo freezing, anything like that.
Yeah, so I mean, kind of what Kristen was saying too, there was this fear of like, is this responsible? Am I doing something that like I never want to leave my kid with loss, right? None of us want to. So it was like having to think of all this stuff ahead of time, like, am I making an irresponsible decision by having a child? And so a lot of my conversation was, I guess, I wasn't sure. I mean, I was 24 when I was diagnosed. I'm like, of course I want kids. Do I want kids? I don't know. And then when they found what turned out to be the benign tumor in my liver, it was a month period where they thought I had mets at that point. So it was a month that I was like just kind of waiting for answers, as you guys know. So in that month, I noticed that one of the biggest things I was grieving was that I felt like I wasn't I wasn't sure if I was ever going to be able to have a family. And that was always like on the forefront of my mind of like I just really wanted to raise a little human. And of course, with all the other things of like, I also would like to survive, you know? um, but after that, once we found out that it was actually benign, so we had eloped right after my diagnosis in 2020. We eloped. And then after that, we were like, well, let's just start trying to have a kid then. You know, why not? My oncologist, again, he was really encouraging and he was like, just live your life. You know, one of the things he had told me was that there's not a lot of research out there for young women with ocular melanoma and pregnancy. We don't know how the hormones impact. I didn't have a nucleation, right? So I did have the brachytherapy. So the tumor's still like, it's dead, but you know, it's kind of still there. So there was always the like, could the hormones impact it to regrow, things of that nature that we just didn't know. And he was like, just don't let it take the rest of your life from you. So I was like, okay, you know what? We're just going to do it. But it did take us, you know, a few years. I had gone through fertility doctors, all that good stuff. And we were just about to start some treatment. And then I found out I was pregnant. So, and that was in December of 2021. So I think I had a hard time making the decision. I still do sometimes. I won't lie. I think I battle with that back and forth every time it's time for my scans. Every 6 months, I'm like, please. I just, you know, I look at my little toddler and I'm like, I just want to be here for him. And so I do
Yeah.
battle a lot of like, did I make a mistake? Should I not have not that he's a mistake, but I just don't, you know, there's still this battle, this internal
Yeah.
battle. I wouldn't change it for a thing, but ultimately, you know, I did try to reach out to like the ocular melanoma community and see like, did anyone have a baby post? And I just didn't get a whole lot of responses. There was not a lot of people who had. So a lot of times, a lot of the people I was running into had kids already, or they were pregnant when they found out. So I just kind of decided to just wing it and hope for the best. You know, I think that's kind of just like the messiness of life. Like you know, my oncologist even told me, so he's like, you could be driving home from work and get into a car accident. Like life is life. So you may as well just live it to what you want to live it as. And I was like, you know what? That's absolutely right. So I wouldn't say that the decision was easy or light, especially with not really having like a lot of people who decided to have kids post treatment. But I just say that like anybody, again, not medical advice, but anybody who wants to do it, like I just think the motto that I was trying to live by was I'm refusing to let cancer rob me of everything, especially us being in our 20s. Like I just didn't want it to take more from me than it already had. So I was like, I'm just gonna do it. And it's been great. I mean, we all know there's ups and downs with like scan time and still having to like do follow-up treatments and all that good stuff. But honestly, I think it was the best decision I made. And I kind of felt like I was taking a little bit of my life back from cancer, if that makes sense. I was able to be like, you know what? My life isn't yours. This is my life. So
Vikki, I love this. I absolutely love your way of framing this, and I'm so glad that you shared this. I know we were talking before we started recording, we were talking about books and like so many good books, right? And there's a really good book that I read. It's called The Happily Ever After Playlist. Log it. It's a good one. It's a really good romantasy, or sorry, not romantasy. It's not fantasy. It's like contemporary romance, but it's there's a quote in there that is, it's basically the same thing that you said. Like, you can't control the bad things that happen to you. All you can do is decide how much of you're going to let them take. And that stuck out to me. And like, that was exactly what you said. It's just that idea that like you decided to take it back, right? To take back what you could do and how you wanted to live your life. And Kristen, I would argue you even did that. Like, that you took back kind of the frame of where your life looked like it was going. Because I know, Kristen, you were dealing with not just the eye diagnosis and then the rapid enucleation, but like really soon after that, you actually also found out that you were metastatic as well. And like a lot sooner than most people have to deal with. And I mean, I've just like watched in kind of like stunned awe, like how you have navigated all of your treatment that you've gone through, but also pursued getting married. So do you want to talk to us a little about your and Kyle's decision to like get married and like kind of, I mean, I can imagine it was a little bit of a take back feeling.
Yeah, yeah. I would say like when I was diagnosed, like we had been dating for 3 years and then everything just kind of felt like really fast. You know, we do the radiation, we do this. But then more and more in those early months, you're learning that, okay, there aren't a lot of young people out there that I can talk to about this. You know, there's only a handful of people. And I remember meeting both of you very early on, just, you know, even making a brief connection of like, there's someone else there, like thinking some of these thoughts was so validating. But early on, I did try to give like Kyle a choice to be like, you know, this is what happened to me in my early 20s, but you're also in your early 20s and this doesn't have to be your story. And he did not take the out, which I was so thankful for, but I felt like in that point in our relationship when I was learning that, you know, this isn't like what you would think of a quote unquote classic cancer that has a point for remission. Like this could stay with me for the rest of my life and likely will, just thinking about like all of the questions that and uncertainties that come with that. And so we made the decision to stick it out together, whatever that looks like. And so the first year was just kind of reacting to a lot of the next steps, radiation, egg freezing, things like that. And then the second year of my diagnosis, when I got the Mets diagnosis, and we knew it was a possibility because of the percentages that are out there for metastasis and the close scanning that I had been doing. But I did a year and a half of Kimtrack to start, and I got in a really good routine with that. I moved closer to the hospital. We moved in together so Kyle could help support me. And after pretty close, once I got to that year and a half of Kimtrack and needing to pivot to the next thing, is actually when we dove in and decided to get engaged. And at this point, we had probably been dating for like 5.5 years or so. And it was, you know, people like ask all the time when you're at that stage of like, are you guys going to do it? Are you going to get married? And for me, it was such a bigger, complicated thing because I was like, I hope so. But this is really like Kyle's choice too, like in a big way. And I think, I don't know for either of you, but for me, like going to therapy after that first year was really important to, you know, voice those questions and those doubts and those guilts that I was having. And just to be like, you know, like I know Kyle loves me but I just can't get past sometimes that I'm doing this to him. And so having those therapy sessions were really helpful for me to build the confidence to dive in, like Vikki said, on life and live it. And, you know, I was like, this could also be like helpful for other people, you know, like this is our story, our testimony, but like how great is that gift to show that, you know, we're choosing life, we're choosing to live it, and we're choosing to be together no matter what we're facing. And so it was definitely like a hard thing to step into and got more complicated in our engagement season because later I switched to liver directed therapy, right? Like during bachelorette season, shower season. And so it got a little bit more intense in the middle of our wedding planning. But thankfully, since October, I've been on a treatment break. The liver directed treatment is doing really well, and I've been stable since October. We got married in January. So we had really nice months of treatment break and, you know, continuing on after that of just enjoying like these early post wedding months together as newlyweds and just figuring out now what our normal could look like. And so it's very exciting, but yeah, there's definitely been doubts and questions along the way that I've had to fight and pray about and go to therapy and, you know, what it comes down to is, like Vicky's saying, just choosing to live and, just there's no way any of us could predict what the next day looks like.
Yeah.
Cancer or no cancer. So
Yeah.
it's important to just move forward.
No, I think I love what you said. It's important to just move forward because, I mean, that's where time is going, right? Time is moving forward, whether we want it to or not, whether it's going to the end point that we want it to end at or not, it's going to keep going forward. Kristen, I love that you highlighted the mental health aspect of this. And I do want to make sure that we talk about this as we kind of come to the end of our discussion here. I mentioned like PMDD. So PMDD is basically like really intense PMFs. So I have like really, really bad mood swings. I get highly irritable. And those are also a lot of the same symptoms that I deal with when I'm super anxious and when I'm dealing with scans. And I have 3 little kids, like they're 11, 9, and almost 5, I guess 5.5. They're little. And so, I live in a space where I've basically spent almost the last 5 years since my initial diagnosis trying to not let cancer, like, and initially it was trying to not even let like COVID and the pandemic like rule my life more than it needed to, and to like have it be as least disruptive as possible, or like and that's been hard, right? Because to some degree I can't control like how this is going to disrupt my family's life. There are things that have been out of my control, and as a control freak, like that's not easy for me. That's not easy for me to let go of. And so I have done a lot of therapy. Like Kristen mentioned, like I talk to a therapist, maybe not every week, but almost every week. And I only recently started taking a couple of antidepressants at the kind of advice of my oncology team, as well as just kind of a personal decision that like, okay, like I have navigated the mental health and the having the initial diagnosis, losing my vision, getting the class 2, having metastatic scare, and then actually being diagnosed as with metastatic disease, and then the period of like all of the treatment. And like I think that's especially as young people, like we're still in the process of normalizing that it's okay to need support for our mental health. And I think that it can be hard, and like you guys tell me if you disagree, but I think it can be hard, especially when the messaging kind of from the audience, right? The people in your life who are watching you go through this, the messaging is like, oh, you're such a warrior, you're so strong, like and sometimes like that can be helpful, and other times it's not. Other times it's like, no, this is actually really unfair, and I don't want to have to face this every day. I don't want to have to have these hard conversations earlier in life than I had initially thought I would have them. I get to be mad and frustrated about that, right? But I think that that framing of like, oh, you're so strong, sometimes comes at the cost of us deciding like, oh, well, then it's a bad thing if I need more support, right? But I hope we can emphasize that it's not a bad thing to need more support. It's really okay. And this is such a uniquely traumatic thing that everyone processes this differently, and it is so okay to need support, medicine or otherwise. Anyway, so what, Vikki, what kinds of mental health supports do you feel like have been helpful for you?
So before I dive into that, I do just want to say, when I was talking about like fertility and all those things and having a baby, that I also do just want to recognize that not for some women in the ocular melanoma community, that decision was taken from them. And so while I was fortunate enough to be able to go on and have a child, I just want to say that there is still the grief for many women in the ocular melanoma community who had to make the decision that they couldn't have a family. So I did just want to make sure I acknowledge those people and send love to them, that whatever decision that the young women in the ocular melanoma, and men even who are, if they're diagnosed young and want to expand their family, if they had to make the decision that it wasn't right for them, I just want to acknowledge their grief in that too, that there's so many things that fall into being a young
there's so
woman
many things
or
that
young
complicate it.
person. Yes, definitely. So I just wanted to acknowledge that too. But I also am in therapy. I've been going to therapy. It took me a few years right after the diagnosis to go. And I've been with the same therapist for about 4 years now. And for me, I mean, I have an extensive family history of mental illness and like trauma. So there's more to it than just the cancer, right? That it's helped me out with. But I definitely saw a huge increase in, I have pretty bad anxiety. I eventually got diagnosed with postpartum OCD. So just between that, the, anxiety, OCD, the anxiousness of cancer, all of that, the trying to navigate, I think for most of us too, trying to navigate, we got cancer, then there was COVID, and then it's like we're just like in this blur of life. So being able to like sit and talk with somebody who's kind of been through it all with me, I think there's no shame in that. I think that it's amazing. I think everybody, whether you've had cancer or not, should go to a therapist. I definitely do think that it's hard. I think that a lot of us put a smile on our face when we can. There's no shame in needing medication or therapy or anything. And just acknowledging, I would say to Danae, what you said, like sometimes we as patients do just want to hear that, like, yeah, this really sucks and that this is not great, like we don't always have to be strong. And I think that's
Yeah.
okay to accept that. We may feel like we need to be strong for the people around us, but it's also important for us to feel our emotions and work through those as well. So,
Aura Biosciences is a clinical stage biotechnology company focused on developing precision therapies for solid tumors that aim to preserve organ function. Our lead candidate, Belsar, is currently in late stage development for primary choroidal melanoma and in early stage development in other ocular oncology indications and bladder cancer. Our mission is to grow as an innovative global oncology company that positively transforms the lives of patients. For more information, please visit us at aurabiosciences.com.
Yeah, it's such an important thing. Like kind of just to add to what you guys have been saying, it's also so normal to like go through these phases, right? Where you are really low or like you're really anxious, right? So right before scans or like just different milestones that we go through, different things that we see happen around us, right? Like I know like when my kids have birthdays, like I'm always a little more sensitive. Like on the one hand, yes, I'm grateful, right? I'm grateful that I'm here, that I'm here today and that I've had lots of tomorrows, as you guys like keep quoting me all over. I'm like kind of laughing that this became a quote that everyone latched onto, but like, it's a good thing, right? I am here today. I'm gonna be here tomorrow, like, and those tomorrows do add up. That counts, right? But it doesn't take away the fact that the fear is still there and that I have to grapple with that and that I have to face that, in different ways, at different times, and sometimes more so than others, right? Like if I have a recurrence, if there's a scare on my scan, if I have a friend who unexpectedly or even just who just passes away, like people who we know in our community who we love and who we've grown close to. Those are challenging things to go through as an individual, as a community. And you guys, like we're here for each other the best that we can be, but it's okay to need more than that. And I also wanted to touch on kind of what Kristen was talking about, like with her husband, just the idea that like, okay, this is happening to you and it's also happening to your family, right? To your partner, to whoever you choose to share your life with. And that it's okay to need support for them, for you, it's also okay for them to need support. And I think that especially as women, like I'm just going to say it, like we tend to take on a lot more. We tend to take on a lot more than we actually have the capacity for, especially like people like us who are like that type A, like we like to be in control. We like to do things a certain way. It can be really, really hard to like acknowledge that we can't, do all the helping, right? And like it's been challenging for me to accept that it's probably better for my kids to have a consistent therapist than to only have me to talk to, right? Not that I don't want them to talk to me about the hard things that they're dealing with in life or any of that, but that they're at an age where it's important that they know that therapy is a good thing and that they have gone through enough in their young childhood that therapy is really very warranted. But it's hard acknowledging that like I can't that I don't have the capacity to help everyone and to be there for everyone in all the ways that I want to. Guys, we've been through a lot in the last like 5-6 years, just like cancer aside. It's been a crazy, crazy couple years. Well, I want to talk a little about a couple kind of fine-tuning things. So Vikki, when you had your during your pregnancy, what changed in your monitoring? Did your doctors and your oncologists like change what scans you had, if any? How did that all work?
Yeah, so when I found out I was pregnant, luckily I had just like a few weeks before then gotten my last liver MRI. And at that point I'd gone from 3 months to every 6 months. And we had discussions surrounding you could have an ultrasound, right? Things of that nature. But we had major discussions around, okay, if we were to have an ultrasound though, and you were to find something late enough in your pregnancy, there's not really much we could do about it. So we decided to forego scans altogether throughout my pregnancy. So that was nerve wracking. I think I thought about it a lot, especially because pregnancy comes with all types of aches and pains.
Yeah.
Every time I'm like, oh, is that pregnancy related? Is it something else? So I think that was a bit of a struggle. So I didn't actually have any scans through my entire pregnancy. As soon as I gave birth, I had a scan a month later. So there was a lot of anxiousness around that, right? I had gone almost a year at that point without any form of monitoring. So I was just really anxious that I was going to have a newborn, that, and then we were going to find something. Luckily, it was all clean. But in with that, I was also breastfeeding, so there was navigating okay, so you're brand new at breastfeeding, but now you have contrast in your system. So we have to figure out, here's the science between, like, you could just keep nursing. We don't, the contrast could, you might want to pump and dump for a day. Like, there was just all of that.
Mm.
Yeah, like all the
I think that added
questions.
just like an extra level, but we did forego the scans, and I think that just adds. Pregnancy is already stressful. I had a high risk pregnancy, so there was that piece of it too. And just adding that extra level, right, is not something that was easy. I hear a lot, as I'm sure people are like, "Are you going to have another one?" And I'm like, "No, no, I'm not." I think once was enough. The stress and stuff that goes through having to have just the extra level of like cancer on top of all the other things that pregnancy and having a baby brings. So just having to wait for the results of the scan and just going so long without it is definitely stressful too.
Yeah, for sure. Well, okay, I'm glad that you talked about that because I think that's something that is, I mean, it's worth talking about, right? Like that's such a personal decision, and that's definitely a decision, to be made with your doctor, to look for maybe alternative ways of monitoring, and hopefully, as science gets better, because it's
Yes.
getting there, guys. Hopefully, as science continues to evolve, we will have like a reliable blood test that we can have, right? Like where they just draw your blood and they can tell you, oh yeah, there's circulating tumor cells or there's not, and hopefully that will get more precise. I know like right now it's a little like some people can see it, some people can't. But thank you for just opening up that space, and I think just sharing that it could be okay, right? That it could be okay to forego the scans and to,
Yeah.
I would argue, not let cancer rob you of what you're experiencing, right? Of having your pregnancy and just going through that period of time without the added layer of cancer, right? Sometimes we have to put cancer in a box and we just
Yes.
close the lid and we lock it tight, right? And that's okay. Like, it doesn't mean that we don't have to unlock it sometimes and look at it again, but it does. It's almost like, Kristen, I feel like you and I maybe compartmentalize this differently than other people do, but I don't know. Like, I just feel like sometimes like I'm literally just living my life, and I'll go from, okay, yeah, I got really bad news on April 1st and I was devastated for a week, and then like a week later I'm like, yeah, I'm fine. Like, and people are like, how are you doing? I'm like, I'm good. I'm like, I'm fine. Like, what choice do I have, right? Like, what choice do we have other than to just keep on keeping on? Have you guys had any, like, I know, Vikki, you briefly mentioned like interruptions to your cycle, kind of adjusting to things like that. I know I've definitely had some like periods of like, okay, what is going on and why is my period doing weird things? And it's always, I think my level of stress has been anytime I'm late and I'm like, oh crap. Like, even though we have multiple layers of like birth control in effect, is there a chance I could be pregnant? Because I'm in a place where if I were to be pregnant, I would want to know as early as possible, because I would not want a pregnancy that was too far along, to be something that I had to choose between pregnancy and treatment, and that's a challenging choice, right? That's a really hard decision for me to have made ahead of time, and so it's emotionally very distressing if my period is ever late. I'm like, oh my God, no, we cannot deal with this. Usually it's fine. But have you guys had any like kind of ups and downs in your cycle? Anything that's affected that? I know, Kristen, you've been on Kimtrack. Have you had cycle changes because of Kimtrack?
I don't think I can't know a time where my cycle was inconsistent with Kimtrack, but I do just remember it being like an inconvenience for
It's
for
such an
especially
inconvenience.
yes, especially for like when I did liver directed treatment. I remember one time I was just like finishing a cycle and they're like, have you in the gown? And I was like, oh my goodness, like I'm so embarrassed right now because I'm on my cycle and I'm about to get all these tubes. And so I was like, is there anything you guys can do? I understand I can't like wear anything. They're like, we'll give you some disposable underwear. Like, be real here, guys. And then,
Thanks, guys.
and you're already feeling really vulnerable. And I just
Yeah.
remember being like, oh, I would get so frustrated when something like that would like happen really close to a surgery or even close to a scan. And I'd be like, why now? Like, I'm already trying to like deal with something and you're just an inconvenience. But on the opposite side, I think sometimes like it was almost like a wonder and an awe of like, my body is going through so much, but still it's regulating a consistent cycle. And it was this
Yeah.
weird part of normalcy that
Hmm.
was like still there. And I was like in awe of that because of like what your body was going through.
No, it's crazy. It's honestly a little bit crazy that we can go through so much and that our body is still like on a schedule.
Yeah.
And like, yes, like we've all talked about, it's inconvenient, it's not fun. It sometimes if you're physically feeling more crappy, it adds layers of question to like, is this period related? Is this cancer related? I don't know. I also do a lot of blood work, like with integrative cancer treatment. I work with an integrative oncologist. And so we do a lot of labs every 3 months alongside my scans. And sometimes some of the labs that we're watching will be elevated if we happen to, like, you know, if my cycle has moved and changed a little bit and I'm now having labs the same time as I'm having my period, then like I can almost guarantee there will be some of those inflammatory markers that will be high because I'm on my period. And so then it gets challenging, right? In trying to decipher this information with all my doctors and be like, okay, well, is this just because of my period? Or is this because I have liver mets? Like, which is it? Do we know? Like, and so it adds a layer of frustration, but I do like what you said, Kristen, about how like, okay, but also look at how cool our body is. Like it's just going on, doing its thing. Oh my goodness. Guys, periods. Ugh. Yeah. Okay. Well, guys, I feel like this has been such a good discussion. And I feel like this has been really, I hope really validating to the women in our community, especially the young women like Kristen, like Vikki, like myself, who you're navigating all kinds of things that none of us anticipated having to navigate at this age. Please share this and definitely share this with any friends, family, anyone who you want to help kind of like, maybe if you're someone like in Kristen's shoes or in Vikki's shoes and you're getting questions from family of like, oh, are you going to get married? Are you going to have a family? Like send them this episode if you don't feel like you want to talk to them. Like if you want to let someone else speak for you, like let Kristen and Vikki speak to this, you know, speak to their experience so that people can understand like there's so much that goes into this. There's so many feelings and thoughts that we have as patients, and all of that needs space, right? We all need space, and we don't need somebody trying to like rush the timeline of anything. As we end, Kristen, is there anything that you want to say just to wrap up?
Just thank you for having me on. This has been a great conversation. And I think my message to anyone out there listening is that just know that you're not alone in this. I feel like through the process, it could feel like you feel like you're the 1% of, you know, I'm young and I'm single and this, and no one else out there is like can relate to what I'm going through. Or, you know, I'm recently married and want to have a kid. And I think like just in our community, there aren't many of us out there, but know that there are voices out there that you can reach out to like have some of these questions with, and that there's, you know, like we talked about, there's spaces in therapy to talk about your concerns too. I remember thinking like, do I need like a cancer specialist therapist? And I ended up just finding someone who specialized in anxiety and depression. And it was like, these are really the topics I need to discuss. And so, yeah, just know you're not alone. Know that what you're going through and what you're feeling is so valid, and that there are avenues to talk about it.
Thank you, Kristen. Vikki, what about you? Anything you want to share to wrap up?
Yeah, I mean, I would just echo Kristen that I think it's totally normal, and if you just need to lean on support to do that. One of the things that I always wanted to hear as I was like navigating all of this was that like it's okay to have those feelings, to be upset, that like I experienced feelings of like jealousy as my friends were having baby showers and stuff. And even my friends that have babies after me, where I'm like, I wish I could experience my baby shower or I could experience my wedding without this looming thought of cancer. Like, oh, how freeing would it be to just be able to choose to have a baby, like, and not have to do all this thinking. And I think it's okay. I think it's okay to just like be able to accept that I'm allowed. I think I'm allowed to be mad about these things. And in the same breath, also just knowing that like it's okay for us to choose to keep living, and it's okay for us to make those choices for ourselves, to make the life choices that we want without giving cancer another thought if we didn't want to. Harder, I mean, it's easier said than done, but I just think, yeah, leaning on support, making the decisions that you want to do, and just try your best to keep chugging along and trying to live your best life, basically.
No, I love it. Thank you guys. Thank you guys for listening. Please make sure to hit subscribe, share this video, share this podcast with somebody who might benefit from just learning a little about our experiences. And again, I'm so thankful to Kristen, Vikki. Thanks for sharing your stories and for being here. We will see you guys next time.